நான் டாக்டர் சேத்னா சேத்தன், பெயின் ஸ்பெஷலிஸ்ட் ஃப்ரம் EPIONE Chennai எக்மோரில் இருக்குது. இங்கே நாங்கள் நிறைய பேஷண்ட்ஸ்க்கு இடுப்பு வலி, கழுத்து வலி, முட்டி வலி, கேன்சர் சம்மந்தப்பட்ட வலி, நரம்பு சம்மந்தப்பட்ட வலி, இந்த மாதிரி எல்லா பிரச்சனைகளுக்கும் ஆப்ரேஷன் இல்லாமல் நிறைய பாதுகாப்பான ட்ரீட்மெண்ட் முறை மூலமாக ட்ரீட்மெண்ட் கொடுத்துருக்கோம். இங்கே வரைக்கும் மோர் தென் 80% பேஷண்ட்ஸ்க்கு சக்ஸஸ் ட்ரீட்மெண்ட் கொடுத்துருக்கோம். அவங்க இன்றைக்கி ஆப்ரேஷன் இல்லாமல் வலி இல்லாத வாழ்க்கை வாழ்கிறாங்க. இது பார்த்துட்டு எனக்கு அதை விட ஒரு பெரிய அவார்டுன்றது வேறு எதுவுமே தோணலை. ஸோ இதை தான் ஒரு பேஷண்ட்டோட நம்பிக்கை, நான் கொடுத்த சர்வீஸ் அண்ட் அவங்க ஒத்துழைக்கிறது, இதை தான் எனக்கு ஒரு பெரிய அவார்டு கணக்கில் வரும்.
I am Dr. Sudheer Dara, founder of EPIONE Pain Management Group of Clinics. We have with us Dr. Chetana Chetan. She is the clinical head of EPIONE Chennai. So the main purpose of today, all we are meeting is, today is the 3rd anniversary of EPIONE Chennai. In Chennai, we have started this center 3 years back, and successfully we have treated more than 30,000 people who are having chronic pain. So chronic pain means the pain which is, more than a month. So for example, knee joint pain, shoulder pain, spine pain, any other joint pain or cancer pain. So these pains, basically why EPIONE is so special means, in South India, this is the first hospital, this is the first group of clinics which have started treating all these joint pains and spine pain without surgery. You all must be knowing the only answer for joint pains and spine pain are finally surgery. You take for example knee replacement surgery, you take for example shoulder arthroscopic surgery, spine fixation, discectomy. Nowadays the latest science says that you don't need any surgeries. So you have a beautiful option of pain management. In that pain management, what we do is a regenerative therapy. If someone is having knee joint pain, you all must be knowing the knee joint pain comes with a cartilage loss. So there will be a cushion-like thing in between the two bones that is known as cartilage. If the cartilage is lost, then the two bones come together and there will be friction and a lot of pain. So instead of going for major surgery, if you can regenerate the cartilage, the worn out cartilage, you can always bring back the patient's smiles and also make the patient completely pain free. So no need to go for surgery in case of joint pains or spine pain or any other pain. So this is the speciality of EPIONE, which we have started in 2017 in Hyderabad. In Hyderabad we have 3 centers, in Chennai we have 1 center, and in Bangalore we have 2 centers. So altogether 6 centers we are running. Our plan is to make the society completely pain free without surgery. So this is the latest science, this is the latest updated and revolutionary treatment modality what we have started in South India for the first time. Dr. Chetana Chetan is the first doctor to have such type of treatment in Tamil Nadu. So in that way, in Karnataka, Kerala, and also in future, maybe in a time span of 5 years, we will be opening another 25 centers in South India. Then we'll go to North India and also other parts of the world and other countries like Middle East, Bangladesh and all. So this is the vision of EPIONE. Today we are very happy because the EPIONE Tamil Nadu is celebrating the 3rd anniversary successfully. We have treated more than 30,000 patients. Every day our patients number is increasing, because every patient, only one thing they'll have is they don't want to go for surgery. So no surgery for any chronic pains. So that is the main motto of EPIONE. So we'll be spreading and we'll have more centers in Tamil Nadu also. So a lot of patients from nook and corner of Tamil Nadu are also coming to EPIONE Egmore. So we will keep treating these patients without surgery with small injection therapies. So this is how we are going to spread, and I'm very thankful to all the EPIONE staff of Tamil Nadu and also the press which have come today to spread this news to other parts of the Tamil Nadu also. Thank you very much, for this wonderful opportunity of meeting you all, and I thank all the staff of the EPIONE Chennai also. A very good luck for future endeavors.
So EPIONE is the only clinic to offer regenerative treatment, or other clinics also?
This is the first one to offer in Tamil Nadu, first one to offer in South India, as a matter of fact. So No. Once I started this one in Hyderabad, a lot of centers have come up. In Hyderabad, you can see, after me starting the EPIONE in Hyderabad, in Jubilee Hills, there are around 70 to 80 regenerative clinics available. Right now, Tamil Nadu is first is ours only. Then afterwards, a lot of centers are there.
This is the only solution option for avoid by surgery, because if you go to other corporate hospitals, they say go for knee joint surgery.
That's it. Yeah, this is the innovative thing.
No, all ailments you can go for this.
All the joint pains.
Joint pains. Sir.
Yes. All the see, if you take for example surgical part, there are only few joints where you can operate. You can operate on shoulder, you can operate on knee. What about ankle? What about wrist? What about elbow? These don't have surgeries. And even for the knee joint, even for the shoulder joint also, now the surgeries are very last. If nothing happens, then only surgery comes. Why we are not in favor of surgery? Surgery has got a complication rate. So once you do surgery, if something goes wrong, you can never come back. If the pain doesn't come down, or if the correction is not done by the surgery, there is no other option. So that's why surgery is good only, but only thing, at what time the surgery should be done. Where is the time you need to go for surgery is the $1 million question. First of all, you try this regenerative therapy with what is known as PRP. Then, if it doesn't help, then you can think of going for surgery. And if you properly do the regenerative therapy, properly do the PRP, the surgical intervention will never come. So this is again, going for surgery will be very, very lesser chances.
What is the success rate? It is applicable for all ages, even old ages.
It is applicable for even the 15 years to 98. So this is what we have done now. We have done a lot of youngsters, very youngsters like 15 to 20 who are playing these games and sports, where they got a shoulder injury, knee injury, we have done, and up to 98 years we have done, because a lot of people live after 90 also. If they live after 90 years, they almost all, everyone will get a knee joint pain, shoulder pain. So in those cases, surgery cannot be done. That's why in those cases also we can do this regenerative success. So our success rate in EPIONE is around 85 to 90%. But only thing is, this regenerative therapy is not a magic. There are lots of things involved in this. You need to have a big experience. You need to understand the patient's condition. You need to do the scan. You need to measure the damage over there. You need to correct it, and you need to follow up the patient. If you don't follow up the patient, you're just giving, a lot of other doctors, they just think that giving a PRP into the joint will set everything. That is the wrong thing. You need to know where the injection to be done. You need to know how the improvement is going to be. You need to tell the patient what to do, what not to do, precautions and all. So then only the regenerative therapy will be a big hit. So no one can ever think of surgery also.
So what are the stages of knee pain?
Stages, basically you all must be knowing, there are 4 stages. Stage 1, stage 2, stage 3, stage 4. All these stages are for surgery. So the surgeon, what he says is 1, 2, don't operate. 3, 4, operate. But you need to know and you need to understand the actual pathology, what is happening in the knee joint. This is not a stage. See, sometimes knee joint pain comes, a small ligament, small muscle goes wrong. There is no need to go for surgery and no need to see for the stages also. If you can treat that muscle or ligament with a small PRP or regenerative therapy, immediately patient will get a recovery, and completely you will forget the pain, and also you will be happy living a longer life.
So how long is it taken for the treatment, sir?
Treatment depends on the injury over there, depends on the damage over there. If the damage is severe, he or she might need 3 or 4 sittings. If the damage is very simple, single sitting or 2 sittings. So it all depends. We do a scan. We do an ultrasound scan where you can see everything in the knee joint. See, the staging of the knee joint done by surgeons is an X-ray. X-ray shows only bones. Our scan will show everything. Cartilage, muscle, ligament, bone, everything. So, trying to find out what is the reason for the pain is more important. Then in the X-ray you can see only the bones. So bones, if there is something else apart from bones, we will not be knowing. That's why we measure and give the sittings to the patient.
What is the cost of it, sir?
Cost is almost like 75% less than surgery. It depends on sittings. So it will be very cheaper when compared to surgery, and that's not important. Basically now you're getting a knee joint pain and years together you're suffering, coming out of the pain and coming out of then doing your daily activities is more important and than the cost. But when you compare with the surgery, it is 75% less than the surgery.